Welcome to The Current by TreasureCoast.com, where we discuss interesting people, places, and happenings on Florida's Treasure Coast.
Well, Dr. Drake, thanks so much for joining us. I'm really excited to have you on. This is one of the most excited I've been for a podcast, really. I mean, obviously, you know my experience. I recently had a child in tradition, but to talk a little bit about how you all are meeting the demand here in the area and what the delivery rooms mean for parents and for babies is something I think that's going to really resonate with a lot of people who are in the community. I think it might be a good idea, if you'd like, to start with who you are, your background, and what you do now at Cleveland Clinic.
Okay. Yeah. So again, GL Drake, I'm primarily an OBGYN here at Martin. I'm in tradition, I'm in the ambulatory or outpatient setting, which I see both OB and GYN patients in the office. I perform GYN surgeries, and I do a lot of the scheduled cesarean sections on labor and delivery, along with the rest of the ambulatory team. I'm also the women's health site director for Martin Health, the OBGYN department chair for Martin, and the tradition, and I'm the section head for ambulatory OBGYN for Cleveland Clinic, Florida. Our team here at Tradition has grown dramatically since I got here 4 years ago. There were 2 docs and 1 midwife when I first got here. Presently, we've grown the team into 7 nurse midwives, 4 which we have now full-time, 3 which we just recently signed and are aggressively recruiting. We have 5 ambulatory physicians, another physician we just interviewed over the weekend, actually. We have 8 OBGYN hospitalists, 5 nurse practitioners and PAs, and 2 maternal fetal medicine specialists, along with just the numerous nurses and MAs throughout the office and labor and delivery.
Wow.
Sort of the way it's grown quite a bit. So within our system, which is kind of a nationwide phenomenon, the hospitalists cover 24 hours per day in the hospital. What we see is that decreases cesarean section rates, and we have our ambulatory team, which manages patients in the office and prenatal care. One of the things that makes us unique in the way we've set this program up is that we're one group, or one Cleveland Clinic is one of the things that they say. We're not subcontracted hospital teams. And our certified nurse midwife program bridges the gap, because we have the hospitalists that do the inpatient shifts, we have the docs on the outpatient side, and our midwives do both. So they're in the office seeing obstetrical patients, and they're in the hospital doing their inpatient shifts and
right.
deliveries.
Yeah, that's a good overview. That's a substantial amount of growth in a fairly short amount of time, in just 4 years or so since you've been there. What do you think is the most appropriate thing to discuss next? Kind of the growth and how that's responding to the growth in Port St. Lucie and the growing demand without deliveries in Martin North? Or do you want to get into maybe talking a little bit about compassionate care and the parent-to-child bond?
Yeah, we can talk about a little bit of how we're transitioning from, 2 delivery hospitals to 1.
Okay.
If you like. I think that would be a good.
Sure, that's great.
A good segue.
Yeah.
So, as you know, Port St. Lucie is one of the fastest growing cities in the country.
Yeah.
One of the last meetings that I was at, Port St. Lucie is now the 4th in the nation in population growth, according to U.S. Census Bureau. So that's fueling demand for a lot of healthcare services, right? It's also fueling demand for a lot of other services in the area,
sure.
Right? But healthcare is one that everybody's very dependent on. And what we've tried to do is with the growing group, we're trying to meet the needs for a broader range of all women, right? To expand our access. We're investing in the maternal care resources. We're working on the ultrasound with the MFM. We've partnered with the Moores and the neonatal intensive care unit with their pediatric cardiologist. So we're working with them to even do some of their ultrasounds in our office to be able to help, just the growing area for all our maternal care resources to try to meet the needs of this very fast growing community.
Yeah, that's I'm sure it's moving quick. I mean, like you mentioned, there's so many service providers that feel that growth, but then there are people like you who it's almost like a non-negotiable. Like, okay, if the plumbing industry gets a little overwhelmed and they're, okay, all right, you got to wait for your toilet to get unclogged. But for something like delivery, it's almost like a zero fail game. You can't. It's something where it's really difficult to drop the ball on. And so it's good to hear that you guys are putting those resources together to kind of pick up the growing demand with other areas who are now looking to you, and also with just the growth of Port St. Lucie. Like you said, it's just been so fast, growing so fast paced for so long, and that's good to hear. So you guys are actively recruiting more nurses, midwives, doctors as we speak.
Mm-hmm.
Wow.
Yeah, because there's a huge commitment from Cleveland Clinic, both from the physician standpoint, the administrative standpoint, to try to really grow the OBGYN in the area because of that, right? We need to meet the needs of the area. So we're trying to, especially for tradition, we just recently opened a new office at our Health Park 2 office, which is the medical office building directly beside Tradition Hospital. We've transitioned the midwives from Martin North to Tradition, along with our the very successful VBAC program. So a VBAC is a vaginal birth after C-section. Um, and that's, again, all of our certified nurse midwives transitioned over to help that. We've got the Level II NICU partnered with Nemours. We have plans here in the short to long-term future to try to increase that to a Level III NICU, and help, again, meet the needs of the Treasure Coast. We have the maternal fetal medicine specialist that perform the obstetrical ultrasounds and collaborate care for high risk OB patients, because they need a place to go as well, along with the comprehensive breastfeeding support with lactation consultants and educational resources.
Wow.
So again, trying to meet the needs for full women's healthcare, right, with the OBGYNs, the nurse midwives, the maternal fetal specialists, the breast surgeons, pelvic floor specialists. We'll be adding a minimally invasive gynecologic surgeon here in the fall to kind of continue to grow those needs as well.
Wow, so that you're expanding, not just you're expanding just in so many different realms, not just with labor and delivery or what most people think of. They see their OB or labor and delivery when you're getting ready, but everything else that's encompassing that. That's interesting to hear. I wonder what your thoughts are. You had mentioned getting something like a level 3 NICU. I mean, what's the process look like for that to build on something like a level 3 or level 4 NICU, something here in Port St. Lucie? I mean, I imagine that is a very serious undertaking that takes a long time.
Yeah, it takes a lot of work. It takes a lot of dedication from both the OBGYN teams, the pediatric teams, the neonatal intensive care unit teams, anesthesia, um, pediatric surgery. There's a lot that plays into developing a level 3 NICU. Right now, just to give you a distinction, what's a level 2, what's a level 3, right? A level 2
Right.
NICU, infants must be at least 30 days gestation. They have to weigh at least 1,250 grams. Anything smaller or younger than that needs a level 3 NICU. So by being able to increase to a level 3, that's going to give us the ability to help care and keep patients in the area that have a younger gestation for pregnancy.
I'm glad you covered that, because there's people like me who are kind of have no idea what you're talking about. You just know the different levels require a different level of care, but that makes a lot of sense. Obviously, there's a lot more that goes into it, the smaller that they are. What do you think? I mean, for as far as the demand that's growing in Port St. Lucie, and since I think it's probably been since April that Martin North hasn't been, um, I think their labor and delivery has been stopped since April. What's the onboarding been, or what's the influx been
Mhm.
there? It's because when I was there, I think we had talked about this off record, but it seemed pretty business as usual. It wasn't very crowded. It wasn't, we got the care we needed. From your perspective, or from somebody who's in there on a day-to-day basis, what has that influx been like for you? aside from, okay, we're bringing more people in, obviously, and transferring the midwives over.
Yeah, so we're again, what's the analogy? It's the duck swimming on the water, right? You want everything needs to look to be running smoothly, but there's everybody's
Right.
working in the background like crazy, and that's obstetrics in a nutshell, right? I mean, you're in doing a delivery and things, the easy ones are easy, right? But it's when things get complicated is when you need that support staff in the background, right? And everybody has a job and everybody's doing it. And I always tell patients we go to deliver and it's something like that, it's going to look like controlled chaos, right? Everybody's got a job, but we're all it's actually running smoothly. It just doesn't always give that appearance at OBGYN, right? But
Yeah.
it just takes a team, and that's what all this really is. As we grow the team, as we grow the midwives, the docs, the nurses, like all of that is how we develop a successful program.
That's great. And obviously, there's not a way. The hospital, I imagine, at this point has enough rooms and things like that. That's not really the issue. It's more the getting the specialists or people in there who know what they're doing. Does that sound right? Or
Yeah, and it's not just that; it's also just getting the access, right? I mean, when you
Hmm,
have that many influx of that much influx of patients, right? It's not just bringing those patients in; it's caring for the patients you have still, right? So,
yeah.
it takes a lot to meet that access, and that's how growth helps to meet that access.
Okay. Well, what do you think? I mean, I know we wanted to talk about the delivery room as kind of a place for bonding, and I know that that's especially for people who have been to tradition or have had that experience with Cleveland Clinic in some capacity. That's probably a good thing to talk about next. What are your thoughts in that regard, or what are some things that you want to touch on?
Yeah, so as you know, we can explain that a little bit. Bonding is just that intense attachment between the parents and their baby. Our facilities are designed with families in mind, so we have very spacious suites to accommodate both parents during labor and delivery. We encourage the bonding with delayed cord clamping and immediate skin to skin within the golden hour for mother and or father or significant other. We encourage and promote breastfeeding. We have our baby friendly certification at Tradition, which is the baby staying in the room to improve bonding and also with breastfeeding and just other ways outside of that parents can help bond, because that's a question that we get a lot too. Sometimes the dads feel left out, right? So, or the significant other, but just diaper changes, bathing the baby, reading to them, singing to them,
Yeah.
mirroring their movements, mimicking coos, let them feel your face to kind of get used to some of those sensations. Like those are things that help develop some of those early bonds.
Yeah, that's cool to hear because I know for me, I know when we had our first, it was very, you're trying to like pick up on a lot of these things, and it's I'm sure, I can only imagine, it's I imagine that your field kind of moves fast, or at least there's different things that you pick up on, or you try to adapt to, or you're constantly improving what you're doing, and that delivery
Mm-hmm.
room experience is probably one of those steps.
Yeah, and just to speak to that, some of the things that the Tradition Labor and Delivery Unit has been awarded over the past year from several different sources. One's the U.S. News and World Report. I'm gonna read them so I don't
Yeah, right.
mess them up, right? But they won the award for high performing in maternity care, which in 2024, which reflects key measures like C-section rates,
Hmm.
unexpected newborn complications, exclusive breastfeeding. Another one, which is impressive, is the equity in maternal outcomes during the Black Maternal Health Week. for achieving excellent outcomes in C-section rates and reducing unexpected newborn complications among African American parents. They won that award, or we won that award, and then fewer than 30 hospitals in the nation received that distinction. So those
Wow.
things that just we don't talk about a lot, but the labor and delivery unit's very good. We got the baby friendly that I discussed just a minute ago. That's 10 steps to successful breastfeeding from the the World Health Organization. Um,
Wow.
Performance metrics. The primary C-section rate at Tradition is 12.2% for a primary low risk nulliparous patients. The national benchmark is 23.5.
Really?
So almost half of that. So yeah. Some other key awards I got from the Florida Perinatal Collaborative: postpartum access and continuation of care, the PROMPT, which is the pregnancy-related optimal health and hypertension. Again, to help reduce maternal morbidity and mortality for hypertensive patients. The PROVIDE, the Perinatal Risk Optimized Delivery Initiative, which again goes with the C-section rate over a 5-year period of less than 19%. So just a lot of different things that have been awarded to the labor and delivery unit for a lot of hard work and excellent care from the docs and nurses there.
That's unbelievable.
And midwives.
Yeah, I mean, to have that half of the national, I mean, it makes sense because I imagine, I mean, you probably, I'm not going to speak for you, this is your field, but I imagine the C-section rate is certainly a facet of, of course, someone's circumstances, but then different types of care that they're getting, or the people that are looking out for them, right?
Right.
Yeah, that's unbelievable.
And and everybody wants the same thing, right? You want a healthy mother and a healthy baby. So within medical guidelines, we try to go through that either with that from birth plans, patients that may not want epidurals, right, or some other things. But that's fine because again, patients just want to be heard and acknowledged, just like with anything else, right? And we've got a great team of listeners that are very respectful, and that helps to develop trust throughout the delivery process to give everybody a meaningful birth experience.
That makes sense. What are your thoughts on we had discussed compassionate care and parent confidence, I think was the main point of that. Do you want to touch a little bit on that as well?
Yeah, I mean, we can talk a little bit about compassionate care because in the first moments of this process on labor and delivery, right, it helps to foster a sense of empowerment and control and self-efficacy for the new parents, right?
Yeah.
It can significantly boost the new mother's self-esteem and her confidence in her role as a parent, right? And so again, how we facilitate that with our physicians, our midwives, our nurses is to help show empathy and support, and help to facilitate open communication, and be a partner. We want the patient to feel like they're a partner in the delivery process.
Yeah, I could see that. I mean, I know what you mean. I could see how that could lead to someone feeling a little bit more empowered, I guess would be the word, especially for a lot of people who it might be a pretty overwhelming or anxiety producing moment, as happy as it could be. Right. There's also that aspect of like, I remember when our first was born, they told us to leave the hospital and we're going like, what? You want us to take this thing home? I couldn't believe it.
Yeah. Yeah. And, there's all kinds of stories because one of the other things that we're really trying to focus on at Tradition, not just growing, just in the St. Lucie County, but, for the whole Treasure Coast, right? Because the implications, again, with the Level II NICU that we already have, because, Indian River is a Level 1 hospital. So to develop that into a referral site, I got an example of a patient that was with a private doula in Vero Beach. She transferred to Tradition due to the fetal prematurity, subsequently delivered at the hospital. Baby's presently in the NICU, right? All that work, they work together for open communication and compassionate care. I delivered when I know we had to reschedule this a couple times because I was in C-sections, but The one of the one that I did on the initial day was a lady that had delivered at three different local hospitals. You know, uh, and then this was her fourth kid. It was her fourth C-section though, right? And when she delivered, she was just blown away by the care that she received throughout pregnancy, and then just the whole delivery process, how smooth she felt throughout the whole process and comfortable, and how grateful she was, even though it was a very complicated fourth C-section.
Yeah, that makes sense. I mean, I know I had mentioned to you we had our fourth at Tradition, and that was our previous three were not at Tradition. We felt comfortable going to Tradition. We've obviously had friends and family who delivered there. We knew it was a newer, state of the art, well run hospital. But I think we were kind of surprised at, we thought with Martin North, stopping, and with Port St. Lucie, it's got a high demand. We weren't really sure of how it would feel. So we were surprised to feel that we still got the same, if not more, level of attention that we did at other hospitals. Um, and it is interesting, and maybe this is something typical at most labor and deliveries, but you go from let's a triage room to like the delivery room, or you go to NICU, and it really runs like a well-oiled machine. I mean, things move pretty well, and I'm sure that's a testament. It's reflected in obviously some of the awards you mentioned, but it's a testament to some of the people who are kind of buying into facilitating or helping to serve that growth that they're seeing.
Mhm. Yeah, and I'll give credit where it's due. There's a lot of people behind the scenes that are trying to make sure that runs smoothly. Watching to see how fast we're being able to get things turned over, to get somebody else on labor and delivery as you need it, right, and not delivering in a hallway or anything. Like
Right.
there's there's a lot in the background that people don't see, that we're constantly trying to work on to improve.
What do you think? I mean, what's on the horizon for the hospital? I mean, when you think of what things look like in a year or 5 years, um, if you're someone, let's say, who's living in Port St. Lucie or in the Treasure Coast, there's people all over the Treasure Coast who I'm sure are going to be delivering
Right.
there. So, what do you look at as exciting as far as what's coming up?
Yeah, I mean, to me, just the growth is exciting and what we can offer people, right? I mean,
Yeah.
from the maternal fetal high risk, that's part of our team, right, to the hospitalists and midwives, and as that continues to grow, and again, we continue to give them access to care, right, as best we can, because that's always the rate limiting step, right, and to be able to deliver those patients. We're getting a ton of transfer of care requests into our practice, and you know the administration is behind the group 100%. So we've worked on trying to streamline that process. So there's a specific number of patients can call to try to get in and get their transfer during pregnancy, so they can deliver at Tradition Hospital. So there's just, again, to me, the biggest thing is just the growth. What do we look like as we proceed to a level 3 NICU, right? But we're going to make sure we do that in a stepwise fashion so that it's done correctly, and we can continue to grow from that as well.
So right now, if someone needed a level 3 NICU, they would have to go to Orlando or Miami, right?
That's so yeah. Presently, that's Nemours is based out of Orlando, and so they would be transferred to Orlando.
Got it. Okay. Right. 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 Nemours is obviously they've got an office here, right? And but it's more kind of like a satellite office, I guess.
Yeah, that's more. So they also do pediatric care, right? Like that's something they do. That's something we offer as well. But we've partnered with them for the basically the pediatric intensive care physicians, and uh, that's who's in the labor and delivery or on the NICUs.
Yeah, those people were certainly they know what they're doing for sure. I mean, you can tell that there's a lot of confidence, and I think that when you talk about confidence in the parents, a lot of times they feed into the confidence of the people who are in the NICUs and the labor and delivery rooms, the people that they're seeing. You know, I know that's something that can kind of be reflected in the people that you're working with.
Yeah, no, agreed. And that's again, that's why having the right team in place can makes the experience completely different. So yeah, we talked about how the Cleveland Clinic OBGYN team's only been here about 5 years. I just actually passed my 4 years that I've been here.
Mm.
Um, and I came down, I was at Akron General, which is a Cleveland Clinic hospital in Ohio. I was there for 15 years before I came down here. We actually started looking in Florida, believe it or not, to find a vacation type area that we could potentially rent out or whatever, right, on the West Coast. And then as we found out Cleveland Clinic was down here in Martin and Port St. Lucie, then we were like, oh, well, that might be an opportunity. But then one of the days we were out looking, my kids were a little bit younger at the time. They were in elementary school. They were doing something in the back seat that just, I don't know, fighting something, spilled something. We pulled over while we were actually looking at different places. And we pulled over in an elementary school in the Tampa area, actually. And the kids were like, there's schools in Florida. We can go to school down here. Why don't we just move? So that's actually what kind of got us, to decide to start looking, and that's how we came to Florida.
That's pretty funny.
Don't regret it at all. I mean, this is a beautiful, yeah, right. Like we're like, okay, we got their approval. Now we can start. Maybe we can relocate. But yeah, now they're in high school. I've got a couple older daughters. One of them was living in Detroit at the time. We'd been here maybe 3 months. She came down to visit, and her and her fiance fell in love with the place, and they moved 3 months later.
Wow.
They're down in West Palm now. So, it's obviously the attraction to the area. I understand why everybody's moving to this area. It's absolutely beautiful. Weather's good except during hurricane season, and your little showers here and there. But it's an amazing area. So this is, I don't know, are you from here or did you?
Yeah, I'm from here. Actually, I was
moved here as well.
I was born at Martin North. So
oh wow.
Yeah, I was I had two of my kids were born at Martin North, one at Jupiter Medical, and then our last was at Tradition. And I obviously am the most biased person you probably are going to find. I'm with treasurecoast.com and I'm from here, but I'm never surprised when people say, hey, we moved here, we love it here, this place is awesome, because I really do think that this area is such a gem that is, it's kind of one of those things where like, okay, you want to be very proud of where you're at. You want people who are visiting or people who live here to make the most of it. But it's also kind of like, not too loud.
Right. It's the hidden gem. Don't tell anybody.
Yeah.
Right?
Yeah.
Like
Right.
No, that's too funny. But it's impressive that how a lot of the infrastructure is trying to keep up. And I don't just mean in medicine. I mean, you got school systems, you've got trash pickup, you've got all the governmental aspect of things, the police department, fire department. It's just amazing how everybody's got to just stay on their toes to keep up with the growth of the area. It's a different nuance than a lot of other places.
Yeah. And, I think that's a good kind of circle around, because I think that, I'm very, to be honest, I feel very appreciative of like you guys and what you do to keep up with that, because kind of like we said, it's, I think people would probably deal with an overrun or a fire station or a police station that's too busy than a labor and delivery where they're getting bad experience or they're not catering to these things that you're talking about. So it's interesting to see.
Yeah, no, it really is. It takes a lot of commitment to make it work.
Yeah, I appreciate your time, really, both of you. It was an awesome conversation, and I just appreciate you being on. Thanks for what you're doing, and thanks for chatting with me.
Oh, you're very welcome. Thank you for having us today.
See you guys.
Have a good one.
That's a wrap for this episode of The Current by treasurecoast.com. If you enjoyed the conversation, be sure to subscribe so you never miss an episode. You can find us on Spotify, Apple Podcasts, and YouTube. Follow us on social media or visit treasurecoast.com for local events, tips, and news. Have a guest or topic you'd love to hear on the show? Let us know at treasurecoast.com. Until next time, keep riding the current and enjoying everything the Treasure Coast has to offer. See you soon.